Ascites. How to deal with patient presented to you with ascites, whatever the cause. Well, it involves salt restriction. Please focus salt restriction, not water restriction. So the patient can drink water as normal, along with diuretics. So the diuretics would depend on the case. If the case is talking about cold case, I mean there is patient with ascites, there is a fluid in the abdomen, but there is no pulmonary edema, there is no dyspnea, then the diuretic of choice will be spironolactone. But if the case scenario talking about emergency treatment, the case scenario talking about there is abdominal distension due to fluid accumulation and overload, along with dyspnea due to pulmonary edema, then this is emergency, and this will need loop diuretics like Lasix. And also you can use Lasix in case if spironolactone not working. So please focus, it's salt restriction, not water restriction, along with diuretics. For the cold case, use spironolactone. For the emergency treatment, use Lasix, I mean loop diuretics. That's all. Spontaneous bacterial pertionitis. It's very, very, very important in AMC exam. The keyword for it is as following. Patient with ascites, whatever the reason, presented to you with abdominal pain or fever, even if it is low-grade fever. That's directly mean spontaneous bacterial peritonitis, any fever or abdominal pain to a patient suffering from ascites. It's mean spontaneous bacterial peritonitis, straightforward for the AMC exam. For the diagnosis, the best diagnostic test is abdominal paracentesis, and this will show neutrophils of more than 250. So the investigation of choice is abdominal paracentesis. For the treatment of choice is IV cefotaxime, I mean third generation cephalosporin. So that's all related to spontaneous bacterial peritonitis. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.